Hello everyone. In this video, we are going to talk about retina, the anatomy of the retina. So we'll be dividing it into a video series where we'll be discussing about different disorders in retina, and particularly we'll be focusing on the major disorders like the vascular disorders. We'll be talking about retinopathy of prematurity seen in young children and infants. We'll be also discussing regarding the tumors of the retina, particularly retinoblastoma and many other diseases. So let us start with the anatomy. So retina, when we will grossly divide retina into two main important part. So as we see in this diagram, so this the outer part is the sclera. Inner to the sclera is a choroid, and inner to the choroid, let me make a good diagram of the choroid. So this is a choroid, and inner to the choroid we can see there is a retina. So the retina will expand from the optic disc centrally, and it will go peripherally towards the ora serrata. So the terminating point of the retina is also called as ora serrata. Retina, particularly, it is grossly divided into two parts. There is a central retina and the peripheral retina, and the dividing point being the equator of the eyeball. So this equator of the eyeball is formed by those points where the vortex vein will emerge out of the eye. So and there are particularly four vortex vein. They will emerge out from the eyeball, and it will form the equator of the eye. And behind the vortex vein, behind the equator, the part of the retina is called a central retina, and peripheral to that is the peripheral retina. We can also divide retina into three important parts, particularly central retina, mid peripheral retina, and the peripheral retina. The peripheral retina is also the most anterior part of the retina. It is called as ora serrata, and the central retina is the most sensitive part of the retina. It consists of two important components, particularly the optic disc as well as the macula lutea. So the portion, if I show you a diagram containing the optic disc and the macula lutea, then it is the central diagram of the retina. So it is the central portion of the retina. So whenever we are talking about the central retina, it will comprise mainly two important components, that is the optic disc and the particular the important very important and sensitive structure of the retina called as the macula lutea. So the optic disc, its diameter is roughly 1.5 millimeters. To be precise, it is vertically 1.86 millimeter, and horizontally it is roughly 1.77 millimeters. So we can take it roughly a landmark of 1.5 millimeters. So this 1.5 millimeter is the diameter of the optic disc, and thus we also call this diameter as one disc diopter. So one disc diopter is also known as 1.5 millimeter diameter of the optic disc. As we see this, this is the optic disc, and as we go peripherally from the optic disc towards the nasal side, we can sorry towards the temporal side, we can see another portion of the retina. Particularly in this particular diagram, we can see it is called as macula lutea, and just center to the macula lutea, we can see the blue color, that is the fovea centralis. Fovea centralis is the portion of the retina. It consists of mainly, and it consists of only cones. So it is the most sensitive part of the retina. It will be asked in MCQ. So what is the most sensitive part of the retina, which consists of only cones? Then it will be fovea centralis. Center to the fovea centralis, there is a portion that is called as foveola, and center to the foveola, we have a smaller portion called as ombo. So as we go from center to periphery, let me make a diagram to explain that. So there is an optic disc here. So this is our optic disc. The optic disc has a diameter of roughly 1.5 millimeters. As we go temporally 2 millimeter from the optic disc, sorry, 2 disc diameter from the optic disc, how much is 2 disc diameter is roughly 3 millimeters. As we are going 3 millimeters away from the optic disc temporally, we'll find an area whose diameter is roughly 5.5 millimeters. This is known as macula. This is also called as macula lutea. It is a yellow spot that we see in the central part of the retina. Center to the macula lutea, we have fovea centralis. Fovea centralis is the part of the retina where we see only cones, and center to fovea centralis is a foveola, and center to foveola is ombo. So this is our ombo. And as we talk in ear diagram, so when we are talking about the landmarks of the ear, we see a point called as ombo. It is the most prominent part of a tympanic membrane. Similarly, the foveal reflex, whenever we are talking about the foveal reflex, we particularly focus on this point, and it is also called as ombo. So this is a very important landmark when we see through the ophthalmoscope into the eye. So this is particular about the anatomy of the retina. This is the gross anatomy of the retina. So let me show you in the diagram. So as we can see here, this is our eyeball, and in the eyeball we can see we can divide the eyeball by the into equator. So this is the equator where the vortex vein will emerge, and from the posterior to the equator, this portion of the retina is called as central retina, and anterior to the retina is called as peripheral retina, and the terminating point, so this point where the retina terminates, is called as ora serrata. As we can see in this diagram, so this is the nasal side, right? So whenever we are given a diagram of retina, we have to distinguish whether it is right side or left side. So always, how do we do that, right? I will give you a trick. The side where you see the optic disc is that particular part of the retina where there is absence of rod and cones, and you can see the central retinal artery and the veins are emerging through this plane. So uh, if you have so this is in this particular diagram, this is our optic disc, and optic disc is always nasally. So you can make a nose right here. So and temporal to the optic disc is your macula lutea. So so this is how you make an important landmark on the optic disc as well as macula lutea. So this is our right side optic disc. By this way you can say it, right? So make a nose nasal to the optic disc, and temporal to that will be a macula lutea, and determine the site from where it belongs, right? So in this particular diagram, so this is a right sided retina, and we can see the optic disc here. We can see the macula lutea. So this peripheral is a macula lutea, and center to that is a fovea centralis. Center to that is a foveola, and center to that is an umbo. So this is a diagram that we see via ophthalmoscope. Slit lamp by microscope examination will show us this. As you can see, this is area. This is known as the optic disc. So this is and two disc diopter temporal to the optic disc is a yellow area. This whole area is called as macula lutea, and center to that is a fovea. Center to that is foveola, and center to that is umbo. Now we'll be talking regarding the microscopic anatomy of the retina. So retina consists of 10 different layers. So let me make a diagram about that. So this outer part is called as a sclera. So this is a sclera. So and central to the sclera is a choroid, and central to that is retina. So retina is divided mainly into two important areas. The peripheral part of the retina, as I'm making this diagram, is called as your retinal pigment epithelium, and center to it, I mean deep to it, is another layer of the retina called as neurosensory retina. So retinal pigment epithelium is a single layer, whereas neurosensory retina is made of 9 layers. Totally, it makes up to 10 layers. So there are total 10 layers in the retina. As we go from peripherally, as we go from outside to inside, we can divide the layers, right? So if we are going from outside to inside, so we can see, we can make up 10 different layers in the retina. So retina is lying just just inside the choroid. So we'll trace from outside to inside. So first thing that we see is a choroid, and center to just on the inner side of the choroid, we can appreciate a retinal pigment epithelium. As we can see, the anterior membrane of the choroid is also called as the Brooks membrane, and Brooks membrane is a basement membrane of the retinal pigment epithelium. Just anterior to the retinal pigment epithelium, we can see a space. This is known as subretinal space, and it is important to know this space because whenever we are talking about retinal detachment, the detachment occurs at this particular plane. So if we are talking about retinal detachment, it will occur at the subretinal space. Just anterior to the retinal pigment epithelium, we can see a layer of the rod and cones. Anterior to that, there is an external limiting membrane. Anterior to that, there is an outer nuclear layer. Just anterior to that, there is an outer plexiform layer, and anterior to that, there is an inner plexiform layer. Just inner to that, there is a ganglion cell layer. Inner to that is a nerve fiber layer, and just inner to that is an internal limiting membrane. So how do you remember this? So let me make a diagram about it. So so this is our retinal pigment epithelium. So in the retinal pigment epithelium, there are multiple groups, and in these groups, there lies the rod and cone. So these are our photoreceptors. So photoreceptor consists of rod. So this is a rod, the nucleus of a rod, the axon of a rod. So it also consists of cone. So this is our cone, the nucleus of the cone, and the axon of a cone. So just anterior to the axon of the cone, we can see there are certain bipolar cells. So these are rod and cones. This is a bipolar cell. Bipolar cell have some extension. They are going towards the photoreceptor layer. The anterior extension of the bipolar cell will merge with the ganglion cells. So ganglion cell will be there, and the ganglion cell, the axons of the ganglion cell, they will terminate out to be something that we call as the optic nerve fiber. So optic nerve fiber, they are formed from the axons of the ganglion cells. So and also there are certain important glial cells. They are called as Muller cells. So the Muller cells are located here, and their axons, they will move particularly in this direction, and they will form two important layers. So they are forming the inner as well as the outer limiting membrane. So let us compare this diagram with the previous diagram that I have made. So this is our retinal pigment epithelium. Anterior to that, there is a space. This is known as the pre-retinal or subretinal space. Just anterior to that, we can see layers of the rod and cones. Anterior to that, there is an external limiting membrane. These are external limiting membrane. And just anterior to that, we can see this layer. This is our outer nuclear layer. As we can appreciate a plexus around this. So this is known outer plexum layer. So we can see the layer of the bipolar cells, the nucleus of the bipolar cells. They are forming the inner nuclear layer. And just medial, just inner to that, there is an inner plexiform layer. This is our inner plexiform layer. There is a ganglion cell layer, and inner to that, there is a nerve fiber layer. So this is our nerve fiber layer. And just medial to this, just inner towards this, there is an inner limiting membrane. So in total, there are 10 layers of the retina, and just inner to this, there is a vitreous, and just anterior to the vitreous, we can see the anterior segment of the eye. So the portion which is seen behind the lens, this whole portion is called as the posterior segment of the eye, and the segment of the eye which is seen anterior to the lens, they are the anterior segment of the eye. So retina particularly lies in the posterior segment of eye. So in this diagram, you can see I have made certain blood vessels. Um, they are particularly present in between the outer plexiform layer and the inner nuclear layer, and these vessels are oriented vertically. Okay? And we can also see plexus of blood vessel. They are seen between the ganglion cell layer and the nerve fiber layer, particularly in the nerve fiber layer, and the vessels are oriented horizontally. So the vascular plexus, which is located in the retina, in between the outer plexum and the inner nuclear layer, they are located vertically. So if there is any hemorrhage from these blood vessels, so if there is leakage or there is any hemorrhage from these blood vessels, the clot of the blood, that will be seen either in the form of a dot, or if it is bigger, it will be either in the form of blot. So this is known as dot or blot hemorrhages. So dot and blot hemorrhages are located. They are located in between the outer plexum and the inner nuclear layer. As we can appreciate, there is another vascular plexus which is located in the nerve fiber layer. So in the nerve fiber layer, the vascular plexus, they are located in horizontal plane. So if there is any bleeding from these vessels, so it will be taking in the shape of a flame. So these hemorrhages are called as flame shape hemorrhages. So flame shape hemorrhages, they are present in the nerve fiber layer, whereas dot and blot hemorrhages are present in between the outer plexum and the inner nuclear layer. So this is also a particular important MCQ that will be asked in a retina. So I hope you are able to understand why we get dot and blot hemorrhages, and we also get a particular morphology of flame shape hemorrhages in the retina. So this is very important. And we should also know that the outer four layers of the retina, they are supplied by the short posterior choroidal arteries. They are supplied by the short posterior choroidal arteries, whereas the inner six layer is supplied by the central retinal artery. So what do I mean by the outer four layers? Let us say in this diagram. So let us remember that in the choroid, there is a vascular plexus. So I'll make a diagram on the red. So in the choroid, there is a vascular plexus which is made by the choriocapillaries. These capillaries are contributed by the short posterior ciliary arteries. And this short posterior ciliary artery which gives blood supply to the outer four layers of the retina, particularly the retinal pigment epithelium, the rod and cones, external limiting membrane, and the outer nuclear layer. So these four layers are being supplied by the short posterior ciliary arteries. The remaining inner six part of the retina, the six layers of the retina, they are being supplied by the central retinal artery. So as we have seen in this diagram, so this is our retina. In this particular diagram, we can see that we can see at the area of the optic disc, there is emergence of the central retinal artery. So this is our central retinal artery, and this central retinal artery will supply the inner six layer of the retina, whereas the outer four layer of the retina, they are being supplied by the choriocapillaries. And the choriocapillaries are contributed by the short posterior ciliary arteries. So as I've said, there are two types of hemorrhages in the retina. There is a dot and blot hemorrhage, and there is superficial flame-shaped hemorrhage. So if you are asked deep hemorrhages, they are particularly dot and blot type. So they are dot and blot type hemorrhages, which they are also called as deep hemorrhages. And if you are asked about superficial hemorrhages, they are flame-shaped hemorrhages. So you must be knowing about that. So there are two types of hemorrhages on the basis of morphology. Either it is dot and blot or it is either flame shape. The type of hemorrhage, it depends on the layer where the bleeding is occurring. So similarly, there are two types of exudate in the retina. There is hard exudate and there are soft exudate. So, what is hard exudate made of? It is made up of the lipids, and it has well-defined margin. And whenever we are talking about hard exudate, so it is made of lipoproteinaceous deposit, and they are leaking out of the capillaries, and they are forming a very well-defined margin of exudate. They are called as hard exudates. Whereas if we are talking about soft exudate, they are made because of the axonal debris. So whenever there is any ischemic condition in the retina, the because of the ischemia, the axons they undergo degeneration, and the axonal debris they start to accumulate, and they will form an exudate which do not have an well defined margin. So as if you have seen a cotton, the cotton will have a central dark area, and the periphery will be very blust. It will not be very sharp. So this type of exudate will take a morphology of a cotton wool. So it is also called as cotton wool spots. So if you are seeing cotton wool spots, then it is particularly a soft hemorrhages, and it is made up of axonal debris, and it will signify there has been an ischemia to the retina. So as I've already talked that retinal detachment is the detachment of the retinal pigment epithelium from the rest of the neurosensory retina. So because subretinal space is embryologically, it is very weak. Now let us talk about the blood retinal barriers. So there are two types of blood retinal barrier. There's an outer blood retinal barrier and inner blood retinal barrier. The outer blood retinal barrier, it is formed between the strong adhesion which are present in between the retinal pigment epithelium. So it is called as zona occludens. So as I had made a diagram previously where I had shown you the retinal pigment epithelium. So this is our retinal pigment epithelium. So posterior to that is our choroid. And let us make some blood vessels. So blood vessels are entering from the choroid into the retina. And as we can see, in between the retinal pigment epithelium, there are tight junction in between the so you can see there are tight junction in between the retinal pigment epithelium. They do not allow any exudate or hemorrhage from the vessels underlying the choroid to come into the retina. So this barrier, which is present because of the tight junction or the zona occludens present between the retinal pigment epithelium cells. So this is called as your outer blood retinal barrier. So outer blood retinal barrier, it is formed due to the strong adhesion present between the retinal pigment epithelium. It is called as zona occludens. So no leakage from the choroid occurs into the subretinal space because of this barrier. If there is a breakage in this outer blood retinal barrier, then there will be leakage of the fluid from the choroid into the subretinal space, and that is called a central serous retinopathy. So if you are asked which blood retinal barrier is broken in a disease called as central serous retinopathy, then that is your outer blood retinal barrier. Similarly, we'll be talking about a disease called as cystoid macular edema. And in particular, in disease called as cystoid macular edema, there is breakage of the inner blood retinal barrier. So where is the inner blood retinal barrier? So if you trace a retina, you can see different plexus of the blood vessels within the layers of the retina. So this is your retina. So entire retina will consist of different blood vessels. So these are the blood vessels which is present within the retina itself. And in the blood vessels, there are endothelium. And in the endothelium, there are tight junction in between the endothelial layers of the capillaries. So the tight junction present in between the endothelial cells present within the retina comprises the inner blood retinal barrier. And if this inner blood retinal barrier is broken or if it is damaged, it will result into disease called as cystoid macular edema that we'll be talking shortly in our subsequent videos. So why does cystoid macular edema happens? It is because of the breakage of the inner blood retinal barrier, which is also an important MCQ point. So for this particular video, we'll be talking about this much only. So in this video, we have talked regarding the anatomy of the retina. We talked about the gross anatomy, where I said that the equator of the eyeball will divide the retina into the central and the peripheral retina. We can also divide the retina into central, mid-peripheral, and the peripheral retina. We should know the different landmarks of the retina. We also knew how do we identify whether the retina belongs to right or left side by knowing that optic disc is roughly located nasally, and temporal to the optic disc is your macula lutea. We talked that fovea centralis is the most sensitive portion of the retina. We also discussed on the different layers which are present in the retina, where we said that in between the outer plexum and the inner nuclear layer, there is presence of there is presence of a plexus, and the plexus is located. They are vertically oriented. Because of this vertical orientation, the hemorrhage, if it occurs from these blood vessels, it is called as dot and blot hemorrhages. We also talk about blood vessels plexus, which is present in the out nerve fiber layer, and that if bleeding occurs through this vessel, it will result into a flame step hemorrhages. We also talk that there are two different type of exudate, hard exudate as well as soft exudate. Soft is called soft because the margin are very blurred. The margin isn't very rigid, so it is called a soft exudate, also called as cotton wool spot, which is actually made of axonal debris, and it will signify there is presence of ischemic damage to the retina. Whereas hard exudate is form of lipoproteinaceous deposit, and because of the lipoproteinaceous deposit is probably because of the underlying pathologies like atherosclerosis and so on. So we also talked regarding the hard exudates. So they are having a very sharp margin and they are very well defined. Then we also talked regarding the different layers of the retina, and we said that there is something called a subretinal space, which is embryologically weak, that separates the neurosensory retina from the retinal pigment epithelium. And if retinal detachment happens, it will happen through this plane only. So we also talked regarding retinal detachment for some time, and then we focused on the blood retinal barrier, where I discussed on the outer as well as inner blood retinal barrier. Outer blood retinal barrier is present in between the epithelial cells, the retinal pigment epithelial cells. There is particularly zona occludens present in between them. So it will prevent the leakage of the serous fluid from the choroid back into the subretinal space. If there is the breakage of the outer blood retinal barrier, it will manifest with a disease called as central serous retinopathy. And if there is a breakage in the inner blood retinal barrier, which is actually present in between the endothelial cells of the capillaries, then it will result in cystoid macular edema. So this much for this video. We'll be continuing with pathologies in the subsequent videos. Thank you very much.